Thank you for tuning in to another episode of the Optimal Health Program. Hope you're all doing well. Had a lot of good stuff to talk about today. We'll talk about heavy metal exposure and how it can damage any and every part of your body. And overwhelmingly, people, even young children, have exposure. It just becomes much more significant over time. This is something that the traditional approach doesn't look at, but there are hundreds of thousands, literally, and more studies about heavy metals and the damage they can do. We'll talk about home remedies for a common problem, constipation. So many people seem to have that. We'll talk about different ways to help to reduce bloating and indigestion. We'll also talk about what you might be able to do to help with your blood pressure. Interesting comment on blood pressure. They talk about a variety of things that might help, but when you're looking at just putting foods on board to see if that food has magnesium or potassium in it, and to see if that's going to make a difference, we'd have to first understand whether or not you're deficient in magnesium or potassium. You want to see if your weight is controlling your blood pressure more than anything else, because bringing the weight down will burn the fat, make it easier to get rid of extra water held by the fat, and decrease that extra fluid volume and bring down your pressure. So there are many things that can cause it. So I caution people when they read something that says, oh, eat this food and it'll do this or that. Well, it might not, because that might not be part of the cause of your problem. Yes, of course, for hypertension, we tell people to cut out salt, because sodium helps to retain water. We'll also tell people to do routine exercise every day, because the exercise dilates your blood vessels and gets them to easily dilate so that you could put more blood flow through them. You could deliver more oxygen, vitamins, minerals, or hormones to your cells as a result of doing the exercise. Yes, we check for red blood cell and magnesium, potassium, and calcium. We look to see what nutrients you might be deficient in. Correct that as well. Hormone decline also would lead into this, because if the hormones are not there and your body's gaining weight and accumulating fat, then that may be a reason for your pressure to spike. So there are so many different components to this. Looking at some of the foods they talk about, and it's interesting. Berries are good for you, certainly. They don't have a lot of sugar in them, so that's important. But they say having berries as a snack every other day may help. It may not, because if the other causes are there and they're more significant, they'll override just having some berries. With beets, dark chocolate, kiwis. Yeah, be careful of sugar too, because sugar may interfere with your body's ability to burn sugar, fat, cholesterol, triglycerides, and bring down your weight. Watermelon, although these things may taste good, it may not make a difference in your case. Oats, a grain, so I have a little bit of an issue with some of the things that they're talking about, because I don't know that any one food or any combination of foods is going to make that difference. Again, depending upon the absolute causes of your hypertension. Let's see what else we have here. Interesting comments on constipation and home remedies for that. It seems like there are more people constipated now than ever before. Interesting that when we look at individuals that have issues like constipation, we find low levels of vitamins and minerals. Vitamin C, once you bring that on board, can help. Magnesium, potassium can help. There are some people that take magnesium glycinate that makes a difference for constipation. And of course, people take fiber, they take prunes, they take over-the-counter products, they may take laxatives and things. Drinking more water makes a lot of sense, because you could be dehydrated, especially through the summer months. When it's hot out, you're not drinking enough fluid. That could make it more difficult to move things through your bowel. They talk about fiber, psyllium. Does make sense. Some people like it, some don't.
Just a quick question for the chat, from the chat. Someone's just asking. They had abstained from coffee for a while, and it seems to be affecting their bowels to that extent.
Caffeine does help move things along, so if your body's used to that and you have that on board, once or twice a day, you may get that beneficial effect of the caffeine. The next comment here, number 4 on this page, says to drink caffeinated coffee. Take probiotics. That can help to normalize the organism count in the gut. Senecot makes gummies, which you could use. So there are different things to use, but the question is, once again, why is it there? How did it start? If you're trying to use laxatives but you're dehydrated, it may not work. if you're trying to use water and you're trying to use laxatives, but you're deficient of magnesium, they may not work. So we have to always find out the cause. Mag citrate is also a common recommendation. Try avoiding dairy. Because we do testing for food allergy all the time with so many patients that present with stomach or weird symptoms that they can't understand, screening for allergies to foods, and sometimes it's a chemical in a food, may make a big difference in your ability to have normal bowel function. So remember, what you put into your body is either going to be good for it or bad for it. You put bad stuff in, you're not going to have a good outcome. You put good stuff in, you'll have a better outcome. Some people can't have rice because rice holds on to some of the water and makes it hard for your body to have that movement. So besides what you know or foods that may be bothering you, you want to do the workup, get your blood testing done for your vitamins, minerals, hormones. Hormone decline will correlate with that. So we have to find all the underlying causes.
What are your thoughts on over-the-counter laxatives? Someone wants to know.
I think if people use them judiciously, they may be okay. I typically tell people not to use one thing over and over and over and over again. So in a way, your body might get used to it, to try different things and rotate them. One time it might be magnesium glycinate, then maybe, Senna or Senecot gummies, not gummies that make you woo-woo and hoo-hoo and, make you sleepy and tired with all the added components like the THC in it. I mean, although you wouldn't care if you were constipated if you took that kind of gummy. Gummies that have, laxative or stool softening properties. If the stool's not coming out comfortably and it's really dry and hard, well, then you're dehydrated. So that's an easy one to try to fix. But some people should be drinking 6 to 8 or 9 or 10 glasses of water a day because they just don't have enough on board. And sometimes caffeine will dehydrate you. So although you're helping with the movement, you may be making yourself a little dehydrated.
Yeah, someone in the chat is just saying that I guess a couple of weeks ago you mentioned having less water while you're eating, I guess. And
I wouldn't have a lot of water right before you eat because in a way the idea is that you may be diluting your digestive enzymes, and as they sit there with that water and then that water is going through onward into your system, you're pushing that away from meeting with your food to break the foods down. So I would probably have the water away from your meals. Some people wake up in the morning and drink a lot of water, and they feel full from that. Some people have a protein shake, and in doing that, you're getting proteins, vitamins, minerals. There are great protein shakes out there that are very low in sugar or carb or have none, plant-based like Orgain, the one that I use. And then you could have your water with that or after that, because all that'll do is just get it absorbed into your body. There's no breakdown process when you're taking in a very fine powder with protein and vitamins in it. And then between your meals, drink a good amount of that liquid. It also helps your kidneys flush through waste products of metabolism. So there are a lot of benefits to having a lot of water.
I've joined the Orgain train, by the way. Oh,
I love it.
It's great.
I think it's one of the best ones that's out there. There are others that I used before that over time I just didn't like. And some of them may have more things in it that you don't want. Maybe they're not organic. Maybe they have other buffers or chemicals in them. So just pure organic plant is the best way to go.
Question here, can stress and anxiety really make someone constipated, or is that just in their head?
It can, because stress and anxiety can change parameters in your body, affect your hormone release. You're using up DHEA faster when you're under a lot of stress, and when you don't have enough DHEA or your levels are low, your body mechanism just doesn't work well. You'll feel lousy, you'll feel irritable, you'll feel tired from it. So there are a lot of changes that stress and anxiety create. You can't just say, oh, it's stress, and stop the sentence there. It may be stress interfering with adrenal hormone or stress depleting estrogen, progesterone, or testosterone production. So there's always a better answer when you layer out what else is happening as a result of that stress.
We have a question/story here.
Cool.
He said, a couple of years ago, I went on vacation to Italy, and for some reason, I didn't go for almost 5 days. I was absolutely panicking. I thought something was seriously wrong. My wife joked that we'd have to buy a second seat on the flight home. Then the night before, a nice cappuccino, and boom, everything worked like clockwork. Why does traveling mess up your system so much, and then suddenly, one little espresso could fix everything?
It's hard to say. I don't know how much espresso you would normally have during the day when you're here, and then maybe you didn't have it or didn't have it in and around the time that you're on the plane. And sometimes people get dehydrated on the airplane. Sometimes people are not having the same nutrients that they rely on to help to move their bowel, when they're on the plane and when they land and they go to another place. So it varies. Some people feel very full, they don't eat as much, and they can get dehydrated, in the place that they go to. And once you throw your typical schedule off center, then your body will start to affect and change that. First time I went to Italy, I went to Rome with some friends, had a wonderful time. Stayed in a beautiful little hotel run by nuns right behind the Vatican.
Oh.
It was very inexpensive. If it was $20 a night or I don't think it was euro back then.
Yeah,
it was
the lira.
Back then.
Yeah.
It was just so inexpensive, so that's why we loved it. And of course, I was just starting into practice, so I didn't have crazy money to, afford staying in better places, but the walls were very thin, so it was hard to sleep at night because you could hear every conversation going on around you. The food was amazing, and the coffee and espresso that they made and cappuccino was so chocolatey. It was like chocolatey coffee, and it was so delicious. You'd end up having 4, 5, 6 of them a day. And you were, buzzing around Italy and shopping and seeing all the sights and having a wonderful time. Then I was lying there in bed at night thinking, oh my God, how am I going to sleep? I can't believe I'm still awake. 2 o'clock, 3 o'clock, 4 o'clock. I said, wow, I had 5 espressos today. Maybe that's it. And it was so loud because, again, the walls were thin. I don't think there's any insulation there. I had to take a belt, and I had to put on layers of clothing because it was cold and they didn't have appropriate heat, I think, but that's what you get what you pay for. I had layers of clothing on, and then I had to take a belt and take the pillow and wrap it around my head and tie the belt so the pillow stayed up against my ears.
Desperation.
Yeah, so I could at least muffle out some of the conversation. So, yeah, it was an interesting trip. Amazing trip. I have to go back and look at my notes for that trip.
I know the feeling when you're just like, my ears must be covered. It's just, what else do I do?
Yeah, it's just if you're used to like really, quiet scenario when you're sleeping, you go somewhere where there's all this noise.
And the nunnas never sleep,
Yeah.
They're always out on the window looking, they're judging.
They made great food. It was really a wonderful experience. I'm so glad that I did it. Would I go back and do it now? Maybe for a day or so, just to bring back the memories. But they had all this great buffet. They made amazing food. I mean, Italian people in Italy are gifted with the way that they cook, but the food was terrific. The espresso was terrific. The second I didn't sleep well.
Get me back to Italy. Every time, every store, every show, you get me here, Doc.
Yep, I know.
Thinking about Italy.
Get me back. Got to go back. We've got to do that.
Chad's loving it. All right.
The other story about another common issue besides constipation, which is not necessarily a nice dinner conversation, but bloating. A lot of people have bloating and indigestion. In most cases, I see this occurring with foods, grains, rice, wheat, rye, all the different grains that appear now to be all GMO. So the GMO effect is causing people to have stomach upset, indigestion, bloating. Some people have full-blown allergy to it, which we can check with a blood test or a skin test on the upper arm. And once you take those foods out, the bloating starts to go away. Some people are also sensitive to too much carbohydrate, so the more carbohydrate you eat, you're feeding organisms in your gut to just kind of blow up. And once you got the carbs out and you take the grains away, people say, I can't believe it, the bloating's gone. So it's a fact. I've seen this for so many years. And that's the first thing we'll talk about when people describe indigestion, bloating, and bowel issues. Because at that first consult, I'll give them the idea to change their diet. We'll draw the blood. It takes a week to get them back in to get the blood work reviewed. And we can see what else we can chat about. And food allergy is very common, much more so than ever before. And overwhelmingly, a lot of my patients that go to vacation in different areas, Europe, stay at nice places, and even staying at regular places, pensions, they have no problem eating bread and all the grains there because it's just pure grain. It's not GMO or have the gluten or any of this other garbage in it.
Someone's asking about if you know anything about the Trader Joe chicken situation.
I haven't read up. I don't know much of what's happening with Trader Joe's. I haven't gone. But I've heard some things about Trader Joe, and some of the things may not be as organic as, we'd like them to be. They'd have to give us a little update on what you know.
Yeah, I'm doing my own little research over here. All right. I'll let you know.
There was an organic supermarket in the city many years ago. And the person running it was married to a doctor in the city. And the manager there, and I don't know who was the one responsible for it, were selling products that were not organic, but selling them as organic and charging more. And they got shut down for that. I'm pretty sure that's the story. Don't know who was actually doing it, but, sometimes there are unscrupulous people that will do things. And I don't know if that's happening at Trader Joe's or not. I've heard inklings of some of that.
So I see something. It seems to be, I'm going to say first that it seems to be false, but there was some reports, some fake news some fake news reports of them vaccinating their chickens with mRNA. But it seems to be false. So we'll just...
Yeah, I'm a little worried about this whole picture because the people that want everything and every animal vaccinated and vaccinating all the food that we eat and the cows and stuff, I think some of that is a real thing. There are comments about Canada doing things with aerosols, and vaccinating. Scary, very scary. So people have to read and learn and look and constantly be aware of this. And you've got to trust people who are in the know, like McCullough, of course, Peter McCullough. Follow him, follow RFK Jr., and just look and see what's going on. See what we've been duped into thinking, what things we think are safe and that may not be safe.
Wild times we're living in, guys.
I will make a comment on a few things, and we'll talk about heavy metals in a minute. When women are pregnant, they're told not to have fish because of the mercury in the fish. But what you would get from that fish is not a gigantic dose, like it wouldn't be a whole bucket worth of mercury, It would be a finite amount. So one exposure they don't want the people to have. And they don't want pregnant women to have recurrent exposures to mercury. But why is it okay to give that person mercury in an injectable? And then why would it be okay, if that woman's pregnant, to give the injectable but not have the fish? Or multiple injectables? And then why would it be okay to have multiple injectables when a baby's born, including a hepatitis vaccine at birth? And one of the doctors had added up all the doses of what you would get from mercury and aluminum in the injectables, and the number's way, way above what's expected or acceptable otherwise. You could read about this, look this up. So there's some sort of issue going on, and I won't comment on that further, but people have to be aware and look and learn and see what's going on.
Wild. That's all I could say. The chat is, yeah. Well, guys, we're on YouTube today, so we're keeping it light. You know what I mean?
Yeah. Light and happy and peppy.
Staying on.
And bursting with love.
Yes.
See if anybody remembers that reference. That's an oldie. Heavy metal exposure is a horrible thing. A lot of research goes directly to heavy metal toxicity, which is full-blown exposure causing obvious damage. But a lot of people have exposure that's significant enough to cause damage, but you may not know why you're having this or that symptom, or you may not know why different areas of your body or your brain or neurologically your body's changing. So this has been going on forever. Metals have high electrical conductivity. They're 2 and 3 plus charge ions, and they can compete with calcium, magnesium, potassium, the minerals that have similar charge that you would need for your body. A lot of metals are found naturally in Earth's crust, I mean, obviously. And those are heavy metals. They possess a specific density of more than 5 grams per centimeter cubed. So that's a weight concern. A lot of research also talks about one exposure. But when you talk about people eating chicken, shrimp, rice, apples, California wine, which have arsenic in it, you have multiple exposures over years. You know, your head doesn't fall off when you have a little bit of arsenic, but that would be obvious. Wow, this horrible thing is happening. You'd be aware of it, but you may have problems and you may have an increased risk of heart disease, cancer, all sorts of disorders, neurologic disorders, MS, Parkinson's, arrhythmias because of heavy metal accumulation. So there's a little bit of a different understanding that I want people to realize. They say that commonly heavy metals are found in wastewater, including arsenic, cadmium, chromium, copper, lead, nickel, zinc. Cadmium is in lipstick and makeup and cigarettes. Cadmium is in red tattoo coloring, so it's not just wastewater. People think wastewater, oh, I'm not exposed to any wastewater. You may not be, but you don't have to be. You know, lead in jewelry.
Someone just wants to know, how does the metal get into our blood? Like, exactly.
So the easiest way for the metals to get in are through eating a food that's high in metals. Just as I mentioned, arsenic, chicken, shrimp, rice, apples, California wine. Aluminum in pots and pans gets into your food. Aluminum in antiperspirant under your arm in this warm area that's moving around all day, so that gets right into your circulation. Lead, mercury, and cadmium in lipstick and makeup. The list goes on and on. Mercury in fish or fillings in your teeth. The silver fillings are 50% mercury. So there's a lot of exposure. For people that go to their doctor and say, I want to be tested for metals, they may do a blood test, but the blood labs only do 5 metals. So you're not getting a true picture. You're also not looking at storage. You're looking at what's free-floating in your blood that recently came in over the course of the past few weeks. So it's not what your body's holding on to over time. So blood is a quick peek at what you recently were exposed to. But when you do a urine test, it looks at 21 metals from a specific lab called Doctor's Data. And in looking at that urine test, it's more a reflection of what's leaking out of storage as opposed to the blood test that's what's recently been, getting into your body. So the issue is that unless you're doing that urine test, you're not really seeing the true extent of what you have. Then the most accurate component of testing for metals is to do an IV that will pull metals out into the urine and then capture the urine. That IV is done with calcium EDTA. It's a chelating agent and will bind lead and the metals and pull them out so you can see what's coming out. So it's either a peek at what's floating free, blood, a look at 21 metals coming out of storage in the urine, or metals that we're taking out of the body by pulling them out, and that will give you your best and biggest picture.
Someone's just asking, wouldn't it just make sense for everyone to be accustomed to getting screened every few years for this?
It's a genius idea. I mean, I've done that with all my patients. We talk to all my patients about it on the first visit. So in consult, when we check off all the blood tests we want to do, the different breakdowns of the cholesterol, the LDL, the LP little a, the chylomicrons, homocysteine, fibrinogen. When we talk about all the different blood tests we do, we also talk about doing the urine test for heavy metals. So we look at blood. It's a good test to do, but it can't give you that big picture that the urine does, or the bigger picture, the urine after the IV. So everyone should do it. I have so many people that have heavy metal exposure that's through the roof, and they would never know it. And again, you don't have to be working in a foundry. You don't have to be in construction cutting those aluminum studs that you screw the sheetrock into. I mean, that's a pretty big exposure. You don't have to be doing all of that. You can get these things relatively easily from the environment.
Someone's just saying it's an incredible comparison you were making with the vaccines and fish for pregnant people. And then we have a follow-up just saying, what's the best way to protect kids from heavy metal exposure in everyday life? Just like basic things.
Just look to see what they're eating. and make sure all the food is organic. You know, there have been comments of spreading out those injectables over a longer period of time and not giving them all in kids that are under 3 years of age. It's probably a safer idea, but I think there's a doctor, Sherry Tenpenny, that did a video looking to see how much the cumulative amount of what you're getting from those injections is, and the number is crazy high, well above what safety standards are, but that's just routinely what's given. And now the schedule is up to 70 injections, which is insane. Another comment I'll make, and I say this because I want you to look at this and read about it. What do you think the autism status is in the Amish people?
I know the answer, so I'm not going to. Goose egg.
Goose egg. Why? You know, people, you could answer the question yourselves, but look, learn, read about it.
Crazy.
So heavy metal exposure and cardiovascular disease. And remember, let's rewind to a very basic statement. You know, every cell of your body is an electrochemical plant, you know, controlled by the brain. An electrical current occurs to allow your heart to contract. Ions move in and out of cell membranes. It's a very complicated scenario. If you want, you can go back and look at a diagram with a Krebs cycle, citric acid cycle. You could look at individual cell functions, mitochondria, Golgi apparatus, even just to look at pictures of these things, and you'll be able to understand how complicated the mechanism is and how you can damage every step in the pathway there with heavy metal exposure. So this is a great study looking at heavy metal and cardiovascular disease. Commonly lead, cadmium, mercury, arsenic, chromium. And again, they say, oh, it's in air, water, soil, industrial products. No, that's not where you get exposed. You're getting exposed from foods, you're getting exposed from injectables, you're getting exposed from a lot of different things. And these metals, as I say, will damage your heart muscle. And they also will bind to the bad LDL cholesterol to become a foam cell, which can become plaque. There's research on that. You certainly can read on that. Mercury has long been known to damage the heart because the mercury and its charge interfere with minerals, allowing a good contraction of your heart. You need the magnesium, potassium, calcium. If you're blocking those minerals from doing their job, then the heart contraction gets weaker. So, and we've seen people that have had metals of significant amounts, and we've done the intravenous chelation procedure once a week over time, and then we start to see how much better they're doing with their walking, with their mobility, with their memory, their focus, their concentration. Vision can improve. Ejection fraction can improve. So there's a lot that your body will benefit from when you get these things out of your system.
Someone said, I've heard lead exposure can raise blood pressure. How does that even work?
Well, similarly to what I just mentioned about magnesium and potassium, you need those minerals to allow for easy dilation of your blood vessels. And we know that when magnesium and potassium are low, you get a tightening of that smooth muscle, so that would tend to keep your pressure higher. Interestingly, the same thing occurs with smooth muscle around your airways. Asthmatics, when you don't have enough magnesium, potassium, the airways remain a little tighter, and that helps to restrict airflow. But good levels of those nutrients allow for a more open and a relaxed, smooth muscle around the airway or the blood vessel. So if you're blocking those minerals from doing their job, that's probably one of the most common ways that will happen. Again, besides free radical damage, because these metals act as free radicals and they steal healthy electrons from healthy tissues and cause oxidation. Hence, antioxidant vitamins helping to prevent that.
If metals are raising cardiovascular risk, can chelation therapy or detox treatments help?
Absolutely. Only chelation therapy. So you have to define a detox treatment and see what that really means. A lot of people use the word, but it doesn't really mean anything specific, and there's no before and after testing to see what you're looking for, how you're detoxing, what you're detoxing. So I can clearly show you that Through a blood test, we may see some metals show up, but that's only a 3-second look from the blood near the needle going into the tube. For that, one tube would be used to test for metals, one tube for vitamins, one tube for hormones, one tube for CBC, chemistry, whatever. So I can show in the blood, metals are there. I can show in the urine, metals are there, leaking into the urine out of storage. I can show with an IV and then the urine afterwards how much is coming out. And if you did chelation once a week for 10 weeks, and we repeated the urine after the 10th IV, now you look at the first urine and the 10th IV urine and watch to see how much is gone. So we know you're depleting that. That's science. That's fact. All these other, quote, detox ideas, there's nothing to test. If you're wearing a foot pad or you're sticking your feet in a bath, in a little tub like you hear about, what are they testing? Nothing. Why did the water change? Who knows? But they're talking about that being a detox. How could it be a detox? They don't even know what you're trying to pull out of your body. And you can't pull out metals just by putting your feet in some water solution. There's never been any documentation of, this is what's in the solution. This is how it binds. This is how it takes out. We can test it now and see how much is gone. There's just none of that. So
it's a fugazi. We got this.
Poor Fugazi, whoever Fugazi was. Imagine being a line of Fugazi people throughout centuries. Their name means, it's like fake or crappy.
That's the ultimate shun from society. We got this question. Can living near highways, factories, or old homes raise cardiovascular risk just because of the metals in the air? So
there are some great studies that are done in Europe. And anybody who's been to Europe over years knows that, their auto exhaust is horrendous.
We're brutal.
Here, we're better, but it's not as good as we'd love it to be. But over there, between people still smoking, thinking because it's what they think of as a cool thing to do, they're exposed to all this crap from smoking, the car exhaust, the environmental impact of industry spewing this stuff into the air. It's absolute that it creates problems. There was a study done, I'm not sure what country it was in, but I remember talking about all sorts of diseases, lung, asthma, which you'd expect, heart disease and different cancers, higher in populations that were exposed to the road dust. Because what's road dust besides, stuff from the earth? But brake pads have some pretty horrible things in them. And if you're stopping and starting your car and whatever you're doing, some of that brake dust is getting into the environment, and then factories spewing stuff into the air. That's really bad. There's also something I read about that if you live in a home on a golf course, your risk of neurologic disease is like 30 times higher.
Oh, because of this pesticide?
Parkinson's, and because of all the stuff they spray constantly into the grass. Weed killers, animal killers, bug killers.
Wow.
All sorts of stuff. And that makes sense to me. So I wouldn't buy a home on or directly next to a golf course.
So that's what if you hit someone's window and they come out trying to kill you, it's not their fault.
They may come out with 3 heads and, glowing in the dark, etc. A good friend of mine, PJ, is a professional golfer, a spectacular golfer. And I've watched him shoot crazy low scores. He shot a 59 a couple of times. Once on tour at Montauk Downs, and a 59 is insane, out of 72 for people who don't know and love the game of golf. I play with him. He doesn't tie shoelaces. And he hits the ball. He swings so easy, I say that he swings like Bing Crosby sings. It's just very slow, comfortable swing, and he puts the ball wherever he wants. And we were playing Lake Success a couple of years ago. I watched him shoot a 58, a legit 58. And I was blown away. When people on tour and you're watching the game, and Tiger Woods, spectacular, one of the greatest golfers ever, if not the greatest. He and Jack Nicklaus and some of the others. But you watch them make these shots and have low scores. When you sit in the cart with somebody, and of course we're joking around and laughing like idiots, and he hits the score. It's like, my God, this is just it's unbelievable. It's hard to understand. So, and I played with him many times. It's amazing to see how well people can do once they practice something over and over again. But we used to play at Tam O'Shanter, which was a very long-standing, wonderful golf course. It was a gorgeous golf course on the North Shore of Long Island. And the greens were beautiful, the fairways were beautiful. But apparently, if I'm telling the story correctly, the land was on a 99-year lease, and that lease came up a couple of years ago. A family farm, big farm near the area, owned that property, and they owned the farm, big farm property. And developers wanted to buy it and put homes on it and either keep it as a golf course with these high-end homes on it or just make it into a community. As they started to plan and develop everything, they realized the chemical content in the ground, and I guess in some of the water underneath, was just so high they weren't able to do that.
Wow.
So this gorgeous property, that was a beautiful golf course, right now is sitting there and no one can do anything with it. Could someone come along and make it a golf course again? I guess. Would take some work because it's probably a little bit of a mess now, but, they couldn't put homes there because of the exposure. Fact.
That is wild. As our boy RFK says, we're living in a toxic soup. Toxic soup.
Some people think that that's a little bit forward thinking. He's not that far off.
We just got this one comment I noticed in the chat asking if anyone remembers the taste of metal when drinking out of a school water fountain. And I specifically remember that.
Yeah. Who knows what they were putting in that water? Who knows where it came from?
Yeah.
I'm relatively certain that they didn't have these big triple reverse osmosis filtration systems in the school to make that water purified and perfect.
Right.
Because that would have some sort of cost, but really should be done. I tell everybody to do that. You want to really purify your water so you're not showering, bathing, cooking, or otherwise anything with water that's not healthy for you.
Someone just wants to know, how exactly do heavy metals damage the lining of blood vessels? Is it like a physical reaction or is it a chemical reaction?
So, as I mentioned a moment ago, heavy metals will bind to the bad LDL cholesterol and become a foam cell. And then that foam cell is all sticky and can get stuck to the lining of the blood vessel. The inflammatory cascade in the lining of the blood vessels is a pretty interesting multi-factorial, multi-significant area where a lot of things are going on. So let's say your blood vessels are nice and clear and smooth. Now, this isn't a clear, smooth blood vessel, but let's see the spot here. Let me go the other way. On this area where my finger is, has no yellow plaque. So that's a nice, smooth blood vessel. But plaque is all the yellow stuff, the bad stuff. Let's say a virus gets into your system and hits the blood vessel wall, attaches to it, and now it's a little bit rough. It's not glistening and smooth. And now particles of sugar, cholesterol, triglycerides, other bacteria, anything that's floating in your blood can get stuck to that. All of a sudden, you start to build up on that. And we know that viruses and infection are significant for starting plaque because they've done studies on dogs, many years ago, 30, 40, probably 50 years ago at this point, that when they did autopsies on dogs and animals, they found when they got to the basic bottom part of the plaque that viruses were there at the bottom of the plaque, so they believed that that was one of the things that started. And same thing with humans. They did autopsies on humans as a result of learning that from the dogs, and a lot of it was herpes virus, I think, for the dogs, but similar things with humans, Epstein-Barr, herpes virus family. So that can start the roughness, and then things get stuck on that, platelets, fibrinogen, and then that's how the plaque starts to build up. So plaque is not this single entity. It's multiple things. Calcium can harden the plaque, calcified plaque. Fibrinogen, can contribute to that. Fibrinogen is like a gauze bandage, little wisps of cotton. And fibrinogen is great if you cut yourself to go and patch and decrease your bleeding. But too much of it can become an addition to plaque.
Someone's just asking, they said, this may be a ridiculous question, but when you're getting a CAT scan with like a big magnet, Could that be affecting the metals in your? Could that be an issue with the metals in your blood?
It really isn't, because they're not reactive to the magnetic, mechanism of the CAT scans, and a CAT scan is not magnet. MRI is. So an MRI, it's got a magnet. It's a split-second magnetic picture. So it wouldn't pull or push or move metals around in that fashion. Although injectable dyes for CAT scans, many of them will have gadolinium, and that's a bad metal, because that'll stay in your body as it appears forever. Even Chuck Norris, the man who they say is invincible, there's always a Chuck Norris joke about, Chuck Norris doesn't do push-ups. He's moving the earth or something like that.
I miss those things.
Yeah, like the dad jokes that are out there. But the mechanism is such that the more of these things that you accumulate, the more damage they can cause. So you want to get these out of the picture. With Chuck Norris's wife, which I started to talk about, she was diagnosed with gadolinium-induced toxicity. She had so many scans with the injectable dyes that she became sick from it. And the mechanism that we use to pull that is chelation, to pull that stuff out. And we've seen that work nicely.
Is that when you're getting like when I got a test when I thought I was having a problem with, like, I think it was my pancreas, or I was having a bad stomach, and I had that dye. That's the dye you're talking about?
Well, yeah, any of those, and there are multiple dyes, any of those dyes that when you do a test or take a picture, it outlines the lining of your blood vessels, smoothed like a coronary dye, like an angiogram. They're injecting dyes so that dye goes through the blood vessel. If there's a narrowing of the dye, it means you have blockage. If the dye shows a big, wide open blood vessel and it's a thick, continuous, open picture of that dye and it's not pinched, that pinching would be plaque, then your blood vessel's wide open. So any of those dyes are going to have some effect.
Great. I'll be calling your office tomorrow, Doc.
Yep.
There's the number.
Let's comment a little bit about our vitamin packs that we've been doing and our RPM process we've been doing. So, fortunately, Medicare, for the first time that I've heard, and this is an absolute because I've been dealing with this for well over 30 years, 36, 38 years, has this great idea to cover remote patient monitoring. So, for people that have fragile blood pressure, heart arrhythmias, COPD, any of the degenerative disorders, diabetes, Medicare likes the idea of us getting a person a blood pressure cuff, a smartwatch, or a glucometer. There are other devices, too, that are in the hopper that'll be ready soon, so that we can send a patient home with a blood pressure cuff. Whenever they check their blood pressure once a day, they press a button, it goes right to a data collection and right into my computer. So I can track people's blood pressure every day. I can see if their trend is their blood pressure goes higher in the winter or it's high in the morning, so we could really track and understand what a patient's doing. And then just take better steps to fix the problem. For my patients, it might be I would tell them take a little bit more magnesium, and then we'll watch your next couple of weeks of your blood pressure, see if that balances out. Or get them to lose weight, and that brings their pressure down. So you're actively evaluating and treating and correcting things before they become a big problem. Because the big problem when a person's going to crash or get to the ER, Medicare's going to end up spending between $80,000 to $100,000 for that ER visit or an extended hospital stay. So if we could track and fix, it makes all the sense in the world. So Medicare does cover that. They allow us to call you at home and do visits at home. We can send a lab to your home to get your blood done. The glucometer, the smartwatch, checks oxygen, your pulse, looks at rate, rhythm, how many steps you do per day. So it's a genius idea. The glucometer checks your sugar. So we're getting sugar readings as many times as you do them. So it's a perfect way to really track and follow the patient and prevent bad outcomes. So we've been doing this, and it's working extremely well. There are constantly new watches coming out. Samsung makes a new watch for this purpose. There soon will be a bracelet that a man or a woman can wear that really looks at all these parameters, and the same thing, it gets us those readings. There's a Swiss company that's made glasses that when you put these glasses on for 10 minutes, the sidebars of the glasses read your brain speed, so we can see if your brain speed is good going forward as you get older, or if it's slowing down, or you might have an increased risk of dementia or Alzheimer's disease. And then obviously the natural nutritional realm are the things we want to do to put forward to be able to help to improve your condition. So there's a lot of this happening. Similarly, there are companies making a chair that you'd sit in. And as you sit in the chair in the morning, you put your glasses on, read your brain speed. There'd be a device you'd pop on to read your heart rate, like getting an EKG done. It's checking your circulation, your temperature, your oxygen, all the parameters. So in a perfect, beautiful world, and it's not far away, you'd sit in the chair for 10 minutes, relax, and you get all those things read, press a button, it goes right to data, right to our computer. So we can track all of your vitals. It's probably the best idea I've seen in
that's insane.
Looking at testing techniques for patients, because you have a ton of information, not just 3 times a year you're getting a blood sugar or a blood pressure, etc. So we love the idea. And we're working with some big entities now, so it may very well be that we'll have to have a big company that's national do the phone calls with nurse prax PAs and sometimes doctors, and then contract with a company that buys the kits, sends them the device to the patient, shows them how to use it, coordinates all of that, puts that into our computer, because with volume it's impossible. If we get 5,000 patients from a couple of pharmacies, or if other doctors want to do this, through us, it's going to be a lot of phone call, a lot of care, but I have 2 companies in place that are ready to do this for us. So we could expand beyond, just one facility, one practice. So it's really exciting.
Jesse in the chat said, the future is here. That is insane.
Yeah, it's the nicest thing I think that I've seen in medicine, with the futuristic look. There are always new drugs going to come out, and new drugs are always going to have side effects and blah, blah, blah. So that doesn't excite me as much as being able to monitor and check and fine-tune. Let's fine-tune your diet. Let's correct your vitamins, etc. And that's where we are with the vitamin packs. Based on your blood test and your medical concerns or condition, I can check off on a pink sheet what vitamins to take in the morning, what to take in the evening. We send you boxes of the morning vitamins on a roll. You rip it off, open it, take your vitamins at breakfast, you're set. Take them again with dinner. You go out to dinner, you take your vitamin pack with you, you take it, you're set. We recheck to make sure your vitamins are perfect, and there you are. You don't have to deal with 20 bottles of things. And I see a lot of patients, probably 50% of the patients I see are taking way too much stuff, and they just are going way overboard, and they're buying a lot of individual vitamins when they shouldn't, and their cost is going through the roof. So that's why this makes it into a perfect, tailored protocol based to your body and your needs. So
Chat's just asking, do they need to call your office directly?
Yeah, it's usually easier to call the office directly to make a consult. We would either do it over the phone or sit down face-to-face and chat about your medical concerns, make a list of all the things that are happening to you, a history of any surgeries you've had, when you started to feel tired, if it's 6 months ago or 6 years ago, what happened right before that, did you have a flu, anything. And as we work through that and get your blood testing done, then we can understand exactly what your body's going through and fine-tune and fix. Certainly we would do blood and then urine for heavy metals as well, so we want to learn as much about you as we can. And again, the scientific method, which you could clearly understand that, is one of my favorite things, learn as much as we can about you, way more than doctors would ever do. Understand it, fine-tune it, make recommendations to fix it, recheck to prove that we did it, that we got the job done. It's just the only way to practice medicine.
So, someone said, thank you, Dr. Chris. Not everyone's like you. You actually care.
Thank you.
Wow.
Appreciate that. That's what I'm here for.
I couldn't agree more.
Let's see, what else do we have to talk about, RPM? There's also remote therapeutic monitoring where we can evaluate people that are on meds to make sure they continue to take their meds. There's a device that's a little pill box. You put your vitamins in for the whole week. And if you forget to take your vitamins, we get notified. We call you, hey, you forgot your meds. Got your blood pressure pill, you forgot this, you forgot that. So it's also a way to track that. Also, with people that do physical therapy for their medical conditions, we could be on top of that. So it's a nice, all-inclusive mechanism to really help people stay on track. And the things that work best to keep people on track are conversations. If a doctor tells you to take a blood pressure pill and he sends you out in orbit, you don't come back for 3, 4, 6 months, where are you? Who knows? Did that medication work? You have to wait 6 months before you see him to see if it worked? Why? In this circumstance, if I put you on a medication or a vitamin, I want to know right away if it's working. So within a couple of days, if you're on that device, I can say, oh, look, your blood pressure dropped by 10 points for your top and your bottom number. That's great. Oh, look, 2 weeks into it, your blood pressure is terrific. It's way better than before. Or, wow, you've lost 7 pounds, and look how much better your blood pressure is. So we know it. We're seeing it real time. It's just not this guess of, well, let's figure out what happens down the road. Why would you want to try something and not know immediately if it's working? You know, there's an old protocol for blood pressure, and you're supposed to look at dietary change, exercise, lifestyle changes first, and then start with meds. And sometimes the first med is a diuretic, but some of the diuretics push out magnesium and potassium, which could make your blood pressure worse. If that doesn't work, they'll give you a second drug, but they won't get rid of the first drug. Why leave it there if it's not working? Next drug. There's so many different categories of drugs for all sorts of disorders. Why keep the first drug if it's not working? You shouldn't. So that's why if I find out that, probably 50% of your blood pressure is your weight, let's work on bringing your weight down. And whichever mechanism we do, sometimes we'll use the weekly injectables, the GLPs. If we start fixing that, and we're also fixing your magnesium deficiency or vitamin D, etc., or you weren't walking, now you're walking every day. We start to fix all these areas, you get great results. It shouldn't be all about you got to take a pill for everything that's wrong with you.
Amen.
So we're working very closely with some great pharmacies, certainly making some of the compounded products we use, estrogen, progesterone, testosterone, thyroid. There's a great pharmacy, Glendale Pharmacy in Texas. I'm not sure what part of Texas, but it's in Texas. And their cost for the natural thyroid, which like Armour or NP or USP thyroid, for 30, 60, or 90 milligrams, for 3 months of it, it's only $60, which is a fraction of the cost that it's anywhere else up here. So for a lot of patients, we'll get them set up with that pharmacy, and you're saving money. Some people are saving, 50, 75, almost $100 a month because they're getting it for a good price. So there's certain pharmacies that we like a lot. Jericho Pharmacy, right on Jericho Turnpike, is terrific. We use them for a great deal of things. So it's nice to have a good relationship with pharmacies that do the right thing. And Paula and Philip at Jericho Pharmacy are terrific. So
someone wants to know what the situation is with pharmacies and healthcare, or insurance. They're just saying that I'm learning that not going through my insurance, I'm usually saving money with these CVS scams.
Yeah, it's hard to say. There are pharmacies and the big, big store pharmacies. There's pretty dramatic markup on what they're charging. And sometimes they can get things, sometimes they can't. Some of the pharmacies will not carry a drug unless they can make, a bigger profit margin on it. I've seen that, and I know that from inside sources. So people need to look around, and there's an app. Is it GoodRx? I forget the name of the app.
Oh, I've used it. GoodRx.
There's an app where you can check out all the different pharmacies and see what the prices are, and you'll see which ones have the best price. There's also an app for gas where you can plug that in no matter where you are and see who has the best prices for gas. So,
and it's never Sunoco.
Let the buyer beware. Try to find the best prices for what you need to buy. And that's why some of the places like BJ's or Costco, etc., so many people go there because you get better prices. And for some of the things like toilet paper or water and paper towels, you're buying a larger amount at once, but it's lasting you 10 times longer. And if you look at the cost of it over time, you're saving a lot of money. At BJ's, every couple of weeks, or the guys at our karate school will bring in, big things of water. Glass bottles are nice, of course. Their prices for water are so inexpensive, like $4 for 40 bottles, which just seems to be impossible that they would make any profit on that. And then some of them have a mechanism where they're taking all of the bad stuff out of the water. They're, super filtered, so it's better than just taking regular water that's not filtered. You want to have the metals filtered out of the water.
Wait, you saying it's glass too?
Yeah. Mountain Valley Spring Water is a big company that makes glass and puts the water into glass. That's probably the biggest. And they probably have access to Mountain Valley Spring Water directly online.
I was a Costco man until they started to get a little stricter with the ID, which is my father's. So now I can't. They won't let me in. Let me in.
So, yeah, you just got to kind of set up your own little plan. I'm trying to think of who I was talking to that always used to, you got to have a plan, you got to have a plan. Might have been a girlfriend a few years ago who was an interior designer decorator. He said, you got to have a plan. I'm like, okay, I understand. You got to have a plan. And the plan in that circumstance was, you have a room, you have a size, you have this, you have that. What do you want to go with? What do you want to, the feeling, the fabric? Oh, that makes sense. But you've got to have a health plan. And your health plan absolutely needs to include exercise every day. So you'd want to be able to do at least a half hour to 45 minutes of nonstop activity. Indoor bike, outdoor bike, indoor elliptical treadmill in your house, go to the gym, Pilates, yoga, anything that you want to do, but just do something a half hour every day because you're flooding all the good stuff into all your cells. And that has certainly anti-aging benefit for your heart, your lungs, your immune response, everything. Also have a plan for what you're going to eat and what you're going to drink. Get the Mountain Valley Spring Water in bottle. Get your triple reverse osmosis filtration system in the water in your house, so every speck of water is perfectly clean. If there's certain places that you like to shop and you know the quality there, then shop in those places. If there's certain restaurants you go to that you like to eat and they'll give you gluten-free, whatever, etc., just make your plan so you can create great health out of this big, master plan. When we describe this to some people, it kind of makes sense. They start to say, okay, I'm going on vacation. I'm going to go to Florida. I say, well, what exercise are you going to do in Florida? Oh, well, I'm going to do this because, and I can rent a bike there and go up and down. When you go on vacation, you just don't want to sleep there and do nothing. Just do your exercise. Always have that exercise on board.
Never underestimate a walk on a beach.
Exactly. Even better. Fresh air. Even better. Okay, so without any further ado, great show, great calls. Thank you for listening to the program today. Back on tomorrow. God bless you. Not tomorrow. Back on Friday.
Check out the website.
Check out the website, drcalapai.com. Garden City office, 516-794-0404. And we'd love to help you out. Thank you for your emails. We're working feverishly to answer all your emails, so we'd love to help you out. Have a wonderful